Well, good evening, everyone. The clock is ticking at Mercy Hospital of Buffalo. A potential strike is now just days away, and as the hospital prepares for a potential walkout, it has already suspended some of its services. Mercy Hospital announcing as of this morning it has suspended labor and delivery services. The hospital had already announced there would be a temporary diversion of incoming ambulances there. 7 Eyewitness News senior reporter Eileen Buckley talked with the region's 2 major ambulance providers about these suspensions and what you can now expect.
The region's 2 major ambulance providers, Twin City and AMR, say they are working with their hospital and fire department partners to divert patients away from Mercy Hospital in South Buffalo. They say the biggest impact is finding emergency room beds.
So then it causes longer transport times and then fewer bed availability, to the system that's already been taxed.
But the chief EMS officer at AMR says this area is fortunate to have Kaleida Health Hospitals and ECMC. He stressed that even with a full diversion from Mercy Hospital, a life-threatening emergency will be dealt with immediately.
Whether it be a cardiac arrest, a late, imminent birth, and then that kind of thing. So, you would go there, you'd be stabilized, and then transferred to a facility that has the capacity to handle that type of stuff.
How quickly can you make decisions of where to transport, where is best to transport for that patient?
That's a collaborative decision, with the patient and, our team members in the field, depending on what the patient's condition is and everything. And then the patient has the ability to request which facility they would like to go to.
They can expect that we will, as always, make best efforts to respond immediately and provide exceptional care in the pre-hospital environment and provide transport to an appropriate hospital that can treat their illness or injury.
The CEO of Twin City says so far diverting away from Mercy Hospital has been okay, with no massive increase in wait times.
We're able to still transport, especially to specialty care services for cardiac, for neurological emergencies, for trauma. Those hospitals are still available.
As for expectant mothers, Mercy Hospital has now suspended labor and delivery services. But in a statement, Catholic Health says if a patient arrives in active labor where delivery is imminent, they will deliver their baby at Mercy. For non-emergencies, they should not call 911.
Best bet at this point would be, those expectant mothers certainly know around when they're due, and now would be a good time for anybody who is expecting to deliver in the next short period of time to contact their doctors, contact their OBGYNs, talk about options.
Both ambulance providers say the best thing the community can do is avoid needing to go to a hospital if it's not an emergency.
And Eileen joins us tonight. Eileen, question for you. Has any other medical facility talked about Mercy Hospital's preparations here?
Jeff, Kaleida Health is responding to how the Mercy Hospital suspensions are now affecting its system. Kaleida is reporting more emergency room visits and longer wait times expected at Buffalo General Medical Center, Millard Fillmore Suburban Hospital, and at ECMC. Oshai Children's Hospital is planning for additional deliveries, and Gates Vascular Institute already seeing additional cardiac and stroke volume. Jeff, back to you.
All right. Thank you, Eileen, for your reporting tonight. We want to make something very clear here as well. The preparations underway at Mercy Hospital are contract related. This is not connected to the state's vaccine mandate. And on that note, 87% of the state's hospital workforce is now fully vaccinated. In Western New York, hospital staff vaccination rates per county range from 93% to 75%.